into the back lot to go ahead and get that Wine Wednesday segment going. We're talking about sex and babies and all that. So you might take the kids out of the room. So go ahead, and then you can come back because you might want to hear this one. Over 4 million women get pregnant every year in the United States, and there's a new study on how the type of delivery has a direct effect on sexual function. And here to explain more, Dr. Irwin Goldstein from San Diego Sexual Medicine Alvarado Hospital. Dr. Goldstein.
Hi, Chrissy. How are you?
Hi.
Thank you again for doing all these things.
Oh, you know, I appreciate you being here and all that you do. And you're a little sick today, just like everyone else in this entire city. There's how many types of delivery? Because I thought there were 2, but apparently there's more.
Well, so there's the C-section, which is increasing. Now it's 1.2 million C-sections per year versus that's 30%.
Okay.
There's the regular vaginal delivery. Then there's the operative vaginal delivery when you vacuum the head out or you use forceps. Wow. So it's the trauma that we think is the explanation.
So which of the 3 is affected if the most?
Yeah, so the operative vaginal delivery is by far and away associated with desire, arousal, climax issues, all that stuff.
For how long? Forever?
Well, so it's the study ran into a year. They studied firstborn. 280 women studied their firstborn child, given sexual questionnaires before and a year later, and we divided them into the various types of delivery. And the people who had the operative version had persistent dysfunction. So the good news is it's information. So you don't want to, say, "Gee, why me?"
Yeah, don't let it get you down. You have some
We can
answers.
always fix it. Right?
Yeah, right.
So the other thing is breastfeeding is an issue, and we should talk about that.
What do you mean?
So breastfeeding releases a hormone called prolactin.
Right.
And prolactin is an inhibitor to sexual activity. So maybe it's trying to focus you on the child than other things, but whatever it is.
What are you talking about?
So,
that is interesting.
Yeah, so breastfeeding is associated with sexual dysfunction and less interest.
Or just low interest or dysfunction?
Yeah, low interest.
Okay.
Well, it's hard to distinguish, but yeah, so breastfeeding is an issue. The other thing is episiotomy. About 80% of the women had episiotomies in this trial, which is high.
What's an episiotomy?
So it's where the doctor makes an incision to allow the area to be bigger so the baby comes out. It actually prevents tearing.
So traumatic.
Yeah, so childbirth is...
it's legit.
Yeah, it's a 10-pound thing.
So what do you think now? What's the next step for ladies who, they want their sex life back?
Yeah, so it's very high at the first 6 weeks. 6 weeks is sort of the time when you're supposed to be able to resume. Yeah. But up to a year later, there's still a reasonable number of sexual dysfunction cases. So I think the issue is understand that this can happen.
Yeah.
It's a part of a broader thing of new person,
nature,
breastfeeding, exhaustion.
Yeah, it's nature. It's the body and it's the lifestyle.
And used to be just you and him, and now there's you, him, and a third being.
Who really needs your attention.
Who needs a lot of attention on both areas. So assume it's there. But we can do so many things if it persists. Don't let it continue, because that will... Intimacy is really important for relationships, especially with new children.
And you're starting a new study. You got the green light for the study.
Yes, so the drug Addy, this new first ever product for FDA approved for a desire issue. We're now doing a study in San Diego where women can come and get the drug for free. They get paid to be in the trial, and we're going to see some of the benefits of the product. We have over 100 patients on this drug right now. It's amazing.
Interesting. Dr. Goldstein.
Really successful.
I mean, you bring peace to people's lives. I tell you what, if you want more information about the study, you need ladies for the study, right? You need some people.
Pre-menopausal women only.
Pre-menopausal women. Or you just have any other questions, Dr. Goldstein is at San Diego Sexual Medicine at Alvarado Hospital. That's a mouthful. Or just go to our website and click on the Scene On tab, okay? All right, Dr. Goldstein.
Thank you so much. I appreciate it.
No, thank you. Interesting information.